and thank you for tuning in to another episode of the Optimal Health Program. Hope you're all doing well today. A lot of great information to chat about with you. I've got some great articles and studies on exercise and how it works inside your cells. Most people think about exercise and huffing and puffing and, looking good or burning down fat or looking at muscle improvement, but there's so much that goes on. It's like a whole universe inside your cells that can benefit from exercise. So we'll talk about that. We'll talk about mitochondrial function, a very important mechanism inside your cells that creates energy and allows your cells to thrive, and messaging back and forth to other cells. We'll talk about nutrients that may be beneficial for mitochondrial support. We'll talk about NAD, another great peptide. So, and of course, we're taking your calls here at 888-420-9272, 888-420-9272. Want to thank our LFA Rumble family. We had a wonderful show last week, and Frankie and Sabrina and I were thrilled at the number of people watching and listening, and we have a lot of people that are waiting for the program to come on, over 700, so terrific. We love to hear from all of our friends, Reddit, YouTube, Instagram, Facebook, TikTok, and Rumble. So we're here to take your calls. 1-888-420-9272, website drcalapai.com, CALAPAI.com, and the Garden City office for people who'd like to call and chat with the staff or make an appointment, 516-794-0404. As well, for people beyond the moments or the hour and change that we're doing this program, you could email me through the website. You could set up telehealth visits, so we're as available as humanly possible. Myself, my office manager, Donna, and Mindy, my PA, we're working on answering a lot of the emails that you send to us because they're pretty vast in number, but we get back to you within the day. We ask that you put your phone number along with the email to us so that sometimes it's so much easier just calling you and chatting with you that way. But let's begin. So really cool stuff about exercise and the benefits inside your cells. So went on the computer, started looking at all the individual things that we see. Cardiac benefit from stem cells is very significant, as you might understand. So the first idea to talk about is that, of course, you're flooding oxygen into your blood and into your cells from doing exercise. There's 21% oxygen in the air that we breathe, and the more we do, the more we bring in. You're dilating your blood vessels, training your blood vessels to stay open and to just open wide up as soon as you start doing activity. When you first begin, you may not be able to do that right away, but as you train your body to develop that stamina and strength, you're able to open your blood vessels quickly and then deliver all the good stuff. Vitamins, minerals, hormones, as I say, oxygen. Oxygen is a major component of energy production because oxygen will be grabbed by the magnet iron inside your red blood cell and brought into your cells, delivered all over your body, and then NAD, nicotine adenine dinucleotide, will help in the process of creating energy from oxygen. There's a pathway that allows that to create the results. So 36 molecules of ATP will set that mechanism on board. Yet other things, and oxygen getting into your mitochondria, nutrients getting into your mitochondria, allow energy to be made at the level of the mitochondria, which is a second but very big mechanism for energy. Cardiac cells don't regenerate nearly as often as other cells of your body, but some pretty cool studies when they looked at mice and they were looking at activity and put the mice on a treadmill. It must be a very small gym with a very small treadmill. Their heart health was monitored using DNA markers to track the growth of cardiac cells. And based upon this activity where they had the mice on the treadmill, the results were spectacular. Those who did the exercise had more than 4 times the number of new cardiac cells than their non-exercising counterparts. That's a pretty significant increase in cells. Now, they use mice because they're easy, they're simple, they never complain. You ever hear a mouse complain?
Not me.
They have similar mechanisms within their cells and hormones as we do. So pretty cool to see that they made more than 4 times the number of new cardiac cells. So we want to try to get people to do the same type of exercise. And if you look at brain cells, You could actually train your brain to be more responsive by getting more oxygen, vitamins, minerals, and hormones to your brain. Increased blood flow during exercise enhances your neurons because they thrive in oxygen-rich environments. And the same with neurotransmitters. They respond far more favorably with the oxygen environment. And of course, endorphins are released with exercise. So this enhances the entire picture and it makes you feel wonderful. Immune cells, white blood cells, and many of them are increased significantly from exercise. Uptick in white blood cells helps your immune response fight infections, colds. Telomeres are important because they're the end of the genetic code, and they shrink as more copies of each chromosome are made, so shortened telomeres lead to cellular aging. But exercise enhances telomerase, which decreases the shortening of the telomeres. So a lot of wonderful information about exercise, so people should be doing that as often as possible. And I tell people, you don't have to run marathons, go out there, kill yourself. Just start gradually. If you have an exercise bike, get on the bike, pedal it for 10, 15, 20 minutes. You can go up a little faster, a little bit slower, put it in front of a TV or listen to music, and you're distracted. So all of a sudden, your exercise capacity increases. So my mom, and I don't know whether she'll like if I talk about her or not, but we'll soon find out. We have her on the exercise bike, and she's been doing it initially 20 minutes, 30 minutes, 40 minutes. And I think she was watching a program that was very interesting the other day, and she ended up doing it for 57 minutes. So, which is spectacular once you also realize the fact my mom is 95 years old. Shows she's in spectacular shape. Her mind is as sharp as can be. And she's got that old school mentality that I'm going to do what I want and I need to do. You can't stop her from doing things, and that's why that generation was so amazing. But just as when I was a kid and I'd bring home a exam from school and I got a 97 or 98, they would ask me, where were the other couple of points? How come you didn't get the 100? I asked her why she didn't go to 60 minutes to complete the hour of the exercise. So we're going to find out today, how much time she's done. And we may have to have updates and have her call in the show and tell us how much exercise she's doing. Phone lines are open, 888-420-9272. If you'd like to call in to ask a question, 888-420-9272. People have told me over the years, and certainly on the radio, that I speak too fast, but I'll try to slow it down a bit. 888-420-9272. And we'd love to chat with you.
Yeah, I already got a Reddit question regarding skin. It says, hey, Doc, I'm 45, and I keep getting these tiny red spots on my skin that don't go away. They're not itchy or raised, just little dots. Could that be a circulation issue? What do you think? Normal skin?
It could correlate with circulation. It could correlate with allergy. I'd have to see it and look at your blood work to see exactly what your body's doing. So screening for the allergy mechanism through blood might give us some indication, although blood is not a great mechanism for testing allergy because you may not have antibodies near the needle when that blood goes into the tube for 3 seconds within that one draw, because when you do, each tube is about a 3-second fill for blood testing. Some people have circulatory issues that can correlate with that. So we would take a look at each of those areas and see what's causing it. Some people, you correct their vitamins, minerals, get the exercise done, and their skin and some of these little marks start to improve. So without seeing it, it's hard to give you a complete answer.
All right, we got one from YouTube. Hey, I feel like I get out of breath faster than I should, even though I exercise regularly. My endurance used to be much better. Now I find myself needing to catch my breath sooner. Could that be a lung-related problem, or you think it's just aging?
It can come from a variety of things. And I spoke to a patient today and his wife about aging. And I said, what does the term aging really mean? It really means that your hormones have declined over time, and now you have a hard time doing the things that you did before. And you may not be absorbing your vitamins as well, so your gut may not be functioning as well as it did when you were however many years younger. Cell numbers decline, and that's why hormones decline, by the way, because your organs are not going to have the same number you had when you were a kid. If you're a kid and you have 1 trillion cells in your brain, and your heart and your lungs and your liver and your kidney and your pancreas, your intestines, etc., and you probably have 100 trillion cells in your whole body, we know that as we age, those cells shrink. Less cells, less neurotransmitters. Less cells, less hormones. Again, in some people as they get much older, it's more obvious, but you can start to see this occur even in people in their 30s, 40s, and 50s. I found 18, 20-year-old kids in the practice that had low thyroid, low T3 levels. So these things can occur at an early age. It's not really common, but we like to look at all of this to get a better handle on exactly what's happening and not miss anything. So some people that have issues with their lungs might have low magnesium or potassium. We usually check the red blood cell for that because it's more accurate than the serum level. And the magnesium, potassium control the smooth muscle around your blood vessels. So if you look at a blood vessel, hence the nice little blood vessel diagram, poor person here has got plaque in their blood vessels. That's all the yellow schmutz and garbage. But the smooth muscle you can see is this red right below the outer part of the vessel. If that smooth muscle doesn't have enough magnesium, potassium, the tone of that muscle becomes tighter. And if that's the airway or a blood vessel, if it's the airway, your airways are not going to open up as wide to accept air when you're doing activities. So you have a little bit more difficulty breathing because you don't have that relaxation of the smooth muscle. Same thing can occur with your blood vessels. And for people that have hypertension, a very common cause of blood pressure elevation can be low magnesium and potassium. Again, we test through the red blood cell. So there are people that may have changes in their cardiac function that could make it harder to breathe when they're doing activity. Some people have arrhythmias, AFib, and some people don't realize they have AFib. Their heart's a little bit off with beat, but they feel short of breath and they can't do the activity. So it could be from a variety of things, but it's easy to tease this out and to look for this once we take a look at your blood tests and we look at the entire picture.
Okay, and we have this one from YouTube. Do you think or have any patients who have had severe COVID-19 infections and have had long-lasting problems?
Yes. So any bug, virus, bacteria, and there are many, can damage your body, cause inflammation, and your body not maybe poised well enough to repair that inflammation or to change that and make that go away. Whether we talk about Lyme disease, which is a very common, long-lasting inflammatory mechanism, even sometimes when the bug is gone, you can have these things. The same thing occurs with COVID, with Epstein-Barr virus, cytomegalovirus. So we could talk about 1,000 different people of all different ages. People that are young, in their teens and younger, usually bounce back well because their cellular repair and their cell division is massive. You may be dividing, and I looked at this once because I like the idea of telling people crazy facts. When you're 15 or so, you may be making 30 times 29 zeros after it, new cells per second in your body. 100 trillion cells, divide. You have crazy numbers of new cells being made, so your body can take anything. You run the marathon, you do all sorts of crazy stuff, and you're functioning well because your body's repairing itself. As you get older, that may not happen. And someone who gets COVID, whose immune system is weak because their vitamins are low or their hormones are low or their immune system is affected by heavy metal exposure, then you have a hard time getting rid of it. If you don't have enough immune cells, white blood cells, etc., macrophages, T cells, B cells, and there are some people that genetically have a defect in some of these cell lines, they may have a hard time getting rid of it. The curious thing, too, is that we have a lot of people that have had long COVID and reactions to injectables, where we've done vitamin IVs, which help to quadruple your killer cells to fight things. Vitamin IVs, vitamin C, helps to bind to free radicals to decrease the free radical damage and inflammation that occurs there. So there are a lot of different things that we can do once we see what your testing shows. We also have had patients with bad lung disease that caught COVID that were worse and kind of barely made it through. And for those individuals, besides correcting nutrients, vitamins, and minerals, we did stem cell therapy. We did intravenous and then a nebulizer to breathe into your lungs, as the asthmatics who hold that nebulizer, typically with medication in that, to breathe it topically to lungs to open up your airways. We put the stem cell in that chamber and you're breathing that topically to your lungs to shut down the inflammatory cascade and make brand new cells. So that's been a remarkable mechanism to reverse. But that also can work with people that have heart-related changes from this whole scenario. So I think having the ability to do all of these different things gives us so much more weaponry to be able to combat and fight and fix issues. But also understand these are simple, natural, normal mechanisms. These are not drugs with bad side effects. These are vitamins and using your own cells to create repair in your body. So as I say, I may wear many hats and have to be the detective and figure out exactly what's going on and looking at the testing and then put together recommendations based upon that. So there are more and more people that have long haul COVID or reactions, etc., that are popping up now. So we're addressing this, and we have to, because it's a very, very important, very important situation.
Okay, we got a few from TikTok. I tore my meniscus a few months ago, and my doctor mentioned surgery as an option, but I've heard that stem cell therapy might help me deal without going under the knife. Can you explain how stem cells could help repair my knee, and how do I know if I'm a candidate for this treatment?
Yep, this is an easy one. So literature going back forever, many, many decades, and as I tell people, the doctor to first call stem cells a stem cell was a doctor in Germany, Dr. Haeckel, almost 100 years ago. So the idea of cells becoming other cells has been known for a very, very, very long time. It's accepted. It's a given. So when all the countries in the world are doing stem cell therapy for people, and you have massive numbers of knees, hips, shoulders, organ degeneration, etc., and you see results, and then I see it within my patients all the time, I can comfortably say that your own body, through its certain specific cells, can go to repair damaged tissue. So if we take your cells from your body, from the bone marrow, the crest of the ileum, which is the comfortable little extraction here, it takes about 1.5 minutes to do that from that lower part of the crest, and we take those cells, we spin that bone marrow for a half hour at high speed, about 4,000 RPM, and we then take those cells and put them into the joint. Those cells can become ligament, tendon, cartilage, tissue, just like they can become pancreatic cells. They can become new pancreas cells for the pancreas, so that now that organ has newer cells making insulin and help to change and even reverse diabetes. But you can see that on the website. Also, patients with joint damage and degeneration, same thing. You can see it on the website. MS, Parkinson's, stroke, all of these things. So to take your own cells, spin the bone marrow, separate the stem cells out, and put them back into your joint is a simple process, and it works extremely well. So, again, doctors do different things, and there are people that absolutely need surgery, and there are some people that don't need surgery. Just like if you compare Canada and the U.S., people that have cardiac issues and plaque in their coronaries in Canada can't get the bypass done, so they're treated more conservatively. Yet those people that are similar counterparts that have the same amount of disease can get all the bypasses, surgical things done here. And if you look at the outcome over time, it's not much different. There are studies that talk about doing arthroscopy, cutting away some of the tissue. And for some of those individuals, they may more rapidly go towards knee replacement after that procedure. But I love the idea of letting your cells do the job and create that healing and repair. So everyone's a candidate. They're your cells from your body. You can take them out and put them back in as many times as you want. I mean, we don't do multiple treatments because people do great with one. Occasionally, people that have MS, Parkinson's, or stroke have done second IVs and have done beautifully with that. They'll do another one a year later because they felt so good, and they gain significant benefit, 60, 70, 80% benefit, and they'd like to do it again. So we had a lovely woman who lived to 102, and her great-grandfather started this massive truck and tractor company. Everyone knows the name. It's a green and yellow truck and tractor. I mean, wonderful, wonderful lady. And she was playing golf well into her 90s, and she did stem cell therapy once or twice a year with us. But what I'm telling you, when she would walk in, you would never know her age. She would wear Chanel outfits. I mean, she was so impeccably dressed. It really looked like she just stepped out of Vogue magazine, came into the office. Most lovely woman I've met. You know, a big hug and a kiss on the cheek. She was just spectacular. And as healthy, I've never seen anybody that healthy at that age. Not even close. Except, of course, my mom. So, you know, it's amazing how your body has the capacity an ability to heal itself. And that's what we talk about. And that's why we put the videos on the website so people can see that. So, yeah, for the meniscal tear, that would be an ideal.
All right, we got the rumblers are out. Shout out to LFA.
It's rumbling. I can hear the rumble.
Yes, I could feel it. So we had a couple. One person just wanted to let you know that they had no understanding of the term T cells prior to this discussion.
Oh, wow.
They love the program.
Oh, cool.
We have a question from another rumbler saying, I have a problem of my skin itching. I'm fine when dressed, but when I take my clothes off, I start itching from the waist down, but mainly on my calves.
So itching can occur for a variety of reasons. Some of the simplest and most common reasons for itching could be allergy. And I have a discussion every day with a bunch of people for allergy because people come in with stomach and, all sorts of odd circumstances that they can't correlate. But you could eat something today and have antibodies bind to that food, not immediately, but over time. And those antibodies, as they build up over the course of a few days to a week, can create a symptom. And because allergy is propagated through your blood, it can cause itching, it can cause hives, it can cause rashes, it can cause any number of things. So that's a very common cause. Other people that have allergy to things they breathe, slightly different mechanism. You're breathing things in and you might have some sinus or respiratory component there. But typically when people have allergy, when we test via blood and skin, people that have food also have inhalant allergy, or they're reacting to the environment and molds and such. So there are great ways to test for that. Other people can have itching as a reaction to a medication. I don't know what medication a person might be on. So those are probably the two most common reasons. Yet others may have reaction to a detergent that they use to wash their clothes. So, if they're moving around and doing things in their clothes and their skin is, or you're sweating, and your body has exposure to a chemical in the clothing, because that can happen, or the detergent, that might cause it as well. But it's not hard to test out. That's what we do.
All right, back to Reddit. I fractured my ankle a while back, and even though it's healed, I still have stiffness and pain. Could stem cells help with post-fracture recovery and reduce long-term joint issues?
Yeah, so great question. I remember many years ago when I first did my training and I was working in a hospital in Brooklyn that was honestly a little bit of a nightmare, because when you first get out into your internship and you're working in a hospital that has every disease known to man 100 times over, and every patient, has high blood pressure, heart disease, diabetes, this, that, cancers, you're just dealing with so many things at once. It boggles your mind. The orthopedic doctor that was there, Dr. Svilik, I'm not sure he's still around or with us because he was an older doctor at the time. He said, you can't break a bone or damage a bone without having significant soft tissue injury at the same time or preceding the bone break. So when you're a student, you're thinking, okay, what does that mean? How does that happen? Well, if a force comes along to create a damage right before the bone breaks, all that soft tissue damage is occurring before the bone breaks. So the ligaments and tendons that are there will be damaged. Ligaments go bone to bone. Tendons go from muscle to bone. So you have to look at the entire area. There are people who have injuries to muscle on the other side of the tendon because of that injury, and sometimes those muscles need to be stimulated to heal. And, of course, stem cell therapy does that, and so it would for ligaments and tendons. We've injected stem cells into ankles, in between the bones of the ankles to get deep in. So the MRI would be the best test to show us what the entire ankle and foot look like, and we could pepper the stem throughout the area. For a lot of people, we do the intravenous treatment because that gets into your bloodstream and works and could do beautifully throughout your entire body, and then just add into the ankle to create some significant benefit. So we've done it. We've got a great video on the website of a jiu-jitsu guy, nice guy, and he, played his heart out and tore his labrum in his hip. We did stem. Then a couple of months later, he started to exercise again. Gradually, we let him go back, and then he won a tournament. And he's not, a 20-year-old kid. I think he's in his 50s. So to win a tournament at your 50s in jiu-jitsu, which is hard, it's rough. I know. It's not easy on your joints. And you've seen MMA and jiu-jitsu people. You know what it's like. Getting tapped out, arm bars, leg bars, all kind of bars. It's just bad on your joints. But, yeah, stem cell would be ideal for that. Phone lines are open. If you'd like to call in to ask a question, you could do so now. 888-420-9272. 888-420-9272.
Got another TikToker over here.
All right, the talkers are coming on strong.
The talkers.
It used to be the Reds. The Redditors had, like the other day, we had tons of Reddit callers, and the talkers are coming on strong today. That's great.
But, hey, Rumble, this is your chance. You want to talk to a doctor?
That's right. The Rumblers.
There's the phone number right there. All right. As a runner, I've developed a early stage osteoarthritis in my knees. I want to keep running, but I'm worried about long-term damage. Can stem cells help preserve my cartilage and
Sure.
keep me active?
Yep, absolutely. So when I did clinical trial, early on, and we had to go through each clinical trial for each of the diseases that have come to be all the things that I treat. You had to be trained in each one, 100 some odd pages of paperwork to do all the stuff. And that was just in the beginning to get the paperwork set and ready. Arthritis was the most common protocol because people have joint issues more so than almost every other disease. So looking at osteoarthritis, looking at ligament, tendon, cartilage degeneration or damage, which I call the softer tissue arthritis because bone is bone and all these other tissues are softer than bone. Those are the most common because almost everybody will develop a little tear in a ligament, tendon, or cartilage or a disc over time, depending upon activity, especially runners. So to be able to make those areas repair and heal and be stronger, stem is the ideal candidate for that because the stem, as they go in, they become the damaged tissue and create repair. And they keep dividing over time. So that would be the ideal for helping to repair those damaged cells. And of course, we would talk about vitamins and minerals and correcting those because runners are very, very, very frequently depleted in vitamins. So if you're young and you're running and you've got all the energy because your hormones are great, et cetera, you may be depleting your vitamins and you don't necessarily feel it. But as you get older, you're depleting your vitamins and you may not be absorbing as well. So runners, marathon, cyclists, all the people that I see that do a ton of activity, sports figure, pro athletes, bodybuilders, you've got to get your vitamin levels way up above what's expected for your age so that as you burn them up with your activity, you're not keeping yourself depleted because then it becomes hard to maintain your repair and you'll end up with more injury and difficulty. So you've got to get your nutrients up high. But stem would be the ideal.
All right, we got this one. I have chronic hip pain, and my doctor mentioned that I may need a hip replacement in the future. Could stem cell therapy delay or even prevent the need for surgery?
We've seen it delay. We've seen it prevent. So a few comments. Typically, doctors will do an X-ray because they have the machine in their office, which is fine. GPs have done that forever. Orthos do that all the time. But the X-ray is not looking at all of the tissue. It's not looking at the actual ligament, tendon, cartilage, looking for meniscal tears, looking for labral tears, etc. So I don't think the X-ray is the last word or a great test for looking at the softer tissues. That's why we always recommend MRI. For some people who can't have the MRI, we may recommend doing a CAT scan so that we get all that information. So the MRI will tell us exactly how much wear and tear and damage is there. And it's smart to work on this sooner than later because if you wait for the bone to change and then your bone now, instead of having a nice round ball and socket, is worn down and you have destruction of the bone, then you're set with a joint replacement. So I'd rather, and I love seeing people that are early stage, we create the result with the stem and then they have no problem. And just as an aside, if people are low in vitamin D and their bones are not as strong and as great as they could be, or they don't take boron or calcium, etc., when you correct vitamins, minerals, and hormones, including thyroid, DHEA, testosterone is great for bones in men and women, IGF-1, the active component of growth hormone, then you're really strengthening your body going forward. So that's a really big part of the whole anti-aging mechanism that I talk about. So.
All right. TikTok going off. I had a bad ankle sprain months ago, and it still feels very weak. I've heard stem cells can help with ligament healing. Would this work for an old injury, or is it only effective for fresh?
No, it's work on any injury of any age. I mean, we have 70-year-old patients that have had a stroke, and they've had a stroke 10 years ago and still get great result. So when you damage your ligaments and tendons, and I forgot to mention before, your ligaments don't have a lot of blood flow in it at all. So you could break a bone in your foot, your hand, your wrist, or any part of your body. And because your bones have a lot of blood flow in it, juicy bone marrow, your body would heal faster because that's all there. And stem cells are in your bone, of course. So when you talk about ligaments and tendons, when they're damaged or frayed, you don't have the blood flow creating that repair mechanism. So that's why stem are the ideal. So bone breaks usually heal, and it could be anywhere between 6 to 8 weeks or so. But then to fully heal can take 6 months, maybe more, depending upon age and depending upon nutritional and hormone status. But tears of ligament, tendon, cartilage, they don't repair themselves. They can't. That's why the beauty of putting these repair cells in, the Superman cells, can create such a great result or outcome.
Crazy. Lower back pain from a herniated disc. Tried physical therapy and steroid injections, but the pain keeps coming back. Could stem cell therapy help regenerate some disc damage? And how long would it take to see results?
So we can't get a big long needle in to inject and puff up your disc with stem cell. That's not being done as I know at this moment, but I could always go on and look for that. It hasn't been done in the past, but the question is, what does the MRI show specific to that area? It could be your low back. I imagine it might be your low back. So your vertebrae, let's put this over here so we can see it somewhat, sit on top of each other, and in between the vertebrae are the discs. Grinding on the disc can cause herniation of the nucleus inside the disc, like a little marble inside a hockey puck, and that can press up against the nerve root. That can be somewhat uncomplicated, but if you have narrowing of the area that the nerve roots come out, that's called the foraminal narrowing. There's also central canal stenosis, where the cord itself comes all the way down from your brain down to your sacrum. And if there's narrowing in the central canal, you may need to have a procedure done to open up and decrease some of that arthritic pressure if it's hitting the cord, as opposed to hitting the nerve root that comes out. So it really depends on what the MRI says. So we can't inject and puff up that disc. The ligaments that hold your low back crisscross all around your ligaments, your sacroiliac, and we have a lot of sacroiliac patients, and you could inject stem cells into there to create strength and stability. So I'd really have to see to the nth degree what's happening in your back to give you a better answer on what can be done. We use stem cells for your back all the time to work on those ligaments that hold everything in place. But I have to figure out what's happening on your MRI.
Okay. If someone is generally healthy and just wants to use stem cell therapy to maintain their youth, how often would they need treatments? Is there an optimal age to start?
Great question. As I mentioned, the lovely lady who lived to 102, she came in once or twice a year to do it, and she really had nothing wrong with her. And again, she lived to 102, so that's pretty dramatic. We have other people, husband and wives, that come in to do stem. Some do it once a year. Some will do it every 2 years. I like to have something to hang my hat on. Let's say that the blood sugar is creeping up a little bit, their insulin levels are dropping a little bit, so there's a little bit of a pancreatic dysfunction. Doing the stem, all of a sudden you see that come back to a wonderful range. It's just showing me and showing the patient what's happening. We have people also that may have, on an echocardiogram, cardiac test, the ejection fraction might be a little bit lower than we'd like it to be. It could be in the 40s. And then doing stem as an IV, all of a sudden you're getting new heart cells made, and those new heart cells create more contraction, and that comes up. So I'm always looking at the blood work for something. But yeah, there are people that do it once every year or 2 years just to help to rejuvenate their body. And what you're doing is, as your body is changing, and of course it does, and you're losing new cell production, you're just putting brand new cells in to go wherever you have damage, degeneration, or inflammation to create repair. We have people coming in to do their hair and people coming in to do facial rejuvenation. And I pulled off a couple of comments about stem cell therapy for facial rejuvenation, and it works extremely well. Helps to decrease wrinkles, helps to get rid of some of the lines. And I say if you're injecting stem cells into the thickness of your skin, and you might be laying down that one injection the size of maybe a quarter, and you're doing those injections as if the quarters are touching each other, and you're layering this out, you get brand new cells keep coming up and up and up and up over time because those cells continue to divide. So you're creating a great youthful result and appearance as a result of that.
Crazy. I've heard that stem cells can be used to rejuvenate hair follicles and help with thinning hair. How effective is this, and is it a permanent solution?
It's effective because just as you would put those cells to wherever there's inflammation or damage or degeneration, they make new brain cells, heart, lung, liver, kidney, pancreas, gut, joint. So hair is really no different, and facial regeneration is really no different. The question would be is whether or not a person has a genetic predisposition for that hair loss, and everyone knows, the alopecia that occurs down the center. You're not going to take a person who's lost all the hair down the center and at the back of the head and just regrow hair perfectly. For people that don't have that genetic mechanism, then you'll see a better result. But it's not as though we just use stem for that. We'll look at dihydrotestosterone. That's a conversion from regular testosterone. That could help to damage hair. We'll look at heavy metals, vitamins, minerals, hormones. We may use Rogaine foam to dilate blood vessels in the scalp to enhance blood flow to the area. So it's a combination of things we might recommend doing. There's a cap that people use called Capillus, Capillus, which has that light, and you wear that cap. It's on for 5 or 6 minutes. That could also, and that's been shown by studies to help with hair. So you can use a combination of each of these things. And combined therapy is something that I always talk about for everything that we do. We have people that come in that say, I get recurrent colds all the time and I don't know why and I can't stop it. And we do the workup and we say, well, your blood counts, white blood cell count is low. Some of your cells are off or your vitamins are low. Correct the vitamins. We may have them do vitamin IVs because vitamin IVs can help to quadruple killer cells. We may recommend correcting, hormones. They may have heavy metals, and we may recommend alternating with the vitamin IVs with chelation to pull the metals out. So combined therapies, it's kind of the world we live in because we're fixing all sorts of different things. So for hair, I would use all of the different modalities that would be advantageous.
Okay, we got this one. This is a 53-year-old man. I've been waking up with a dry throat almost every morning, even though I don't sleep with my mouth open, according to my wife. Could this be allergies, or should I get checked for sleep apnea?
It's possible, but the first thing that comes to mind is sleep apnea. When people go to sleep, they're not aware that they may be snoring, and that snoring can cause, vibrations in your nose and your soft palate and cause dryness of your mouth. And when your nose gets clogged, your mouth opens wide to get that air to come in. So a lot of people that have apnea, once they go to a facility and they're tested, when the membranes in the nose and the back of the nose and the palate start to become inflamed and you can't get the air in, you may end up opening your mouth temporarily and gasping to get air in. So sleep apnea is an extremely common cause of that. That also makes it hard to get good, deep REM sleep, where it would be nice to have 7 hours of deep sleep where you're recharging and your body's doing beautifully. Strangely enough, AFib is correlated with sleep apnea, so some people have irregular heartbeat because of the apnea. Some people have a hard time losing weight, they gain weight. So there are a lot of things that cycle around that. So although the dry mouth may be an interesting symptom, it's kind of opening the door for us to look at all these other things to see what may be occurring. But that's common.
Okay, and we have this one. I've noticed that my hands sometimes get tingly or fall asleep, especially when I'm working on my computer or using my phone. Am I dealing with carpal tunnel in early stages, or do you think it could be something else?
For a lot of people, the numbness and tingling in their hand can occur at their hand or wrist. When you're kind of popped up and you're typing on a computer and your wrists are pitched all the way backward, that can put pressure on those nerves. Doesn't mean you have carpal tunnel, but it may be an overuse scenario where you're holding a bad position. Some people, and you learn this in medical school, when you sit on a chair and you can cross your arms across the back of the chair, you're pressing on the blood vessels and the nerves, and that can cause numbness and tingling into their hands. And yet other people may have issues with their neck where disc pressure hits the nerve on one side or both, and the neck is causing the numbness and tingling going down to their hands. In as many patients as I've seen that have actual carpal tunnel, where the swelling inside that wrapped sheath around your wrist is creating pressure there, as many people have issues in their neck, and it's not their wrist, it's their neck that's creating that numbness and tingling. So if you have neck issues, we'd want to get an MRI of your neck. Also get an MRI of your wrist to see if there's anything in your soft tissues that's, creating the damage. So it might be part occupational, on your computer and such, or maybe part musculoskeletal.
Okay, we got this one. I've been getting heart palpitations every now and then. They don't last long, and I don't have chest pain, but I do drink a lot of coffee. Could caffeine be the cause, or should I be worried?
Caffeine could easily be the cause. We see that in a lot of people, especially people working long shifts and overnights and this and that. They're taking the caffeine to try to keep awake and gain some energy. But that caffeine, accumulates, and that can cause palpitations. But heavy metals can do that. There are some people that have back problems in the middle of their back, and this may sound weird, but it's true. And we have a lot of doctors that do the osteopathic manipulative therapy, like Dr. Simone, who will say the same thing, where your back and pressure on the nerve roots from your back, and those nerve roots that go to your skin, your muscles, and your organs, could affect the nerve flow to the organ, which could cause dysfunction at the organ. It's called a somatovisceral response. So that's possible as well. I tell people, look at every stimulant you're having. Some people have a lot of coffee, some tea, chocolate, whatever. Look at all your exposures and take those things out of your diet and see what's happening. Low magnesium, potassium, or calcium might also correlate with that. So we need to test the blood to look at that.
All right. TikToker. I was on birth control for 10 years and got off about 2 months ago. I've experienced weight gain, breakouts, and all the other 9 yards. Any advice on how to regulate my hormones?
So, of course, we need to see what your levels are. When you're on the pill and on any hormone and you're shutting down your body's production of its hormone, that's what happens. And you go off of that, your body may be, flailing a little bit and not making enough of the hormone, so your body is taking its time to create that normal level again. We would need to see where you are within the estrogen, progesterone, FSH, LH, all of those things, testosterone, DHEA. And in some cases, the easiest or the best thing to do is, if your DHEA is low, adrenal hormone, take a little bit of DHEA, because that can help to stabilize and convert into a little bit of estrogen, progesterone, and testosterone. So that may just be enough to regulate and to enhance that function and bring it back sooner. IGF-1, the active component of growth hormone, might also help with that. But again, your blood test would have to tell us. Very simple blood test to do. Of course, we'll talk about vitamins, minerals, everything else. But that's probably the best way to correct, and it's a simple step. It's not too difficult to do that. But then after you make the recommendation, you recheck to make sure that your blood work is great, your symptoms are gone. So it's the science of understanding what's going on and then taking steps to correct that.
Okay, we got this woman on Reddit asking, she's been having a harder time remembering names and little details. She said it's not major memory loss, just more noticeable than before. Brain fog, couple things. Can stem cells help with this? Is this just aging, or should I be worried about early dementia?
Well, for the majority of people that I see in their 40s and beyond, we see this really frequently. Sometimes it's vitamin deficiency. Sometimes it's decline of hormones. Sometimes it's allergy, because allergy can cause brain fog. For other people, it's heavy metal exposure. So if it's something that simple, then correcting those things can make the difference. If we correct those and the results don't pop like we'd like them to, you always have the option of using stem cell therapy, because you're taking your own cells, putting them into your vein to go everywhere in your body and to drip them into the nose so it goes to your brain, and you're making brand new brain cells wherever you may have a decline in those cells. I don't know what age individual we're talking about, but you always have stem cells for repairing any of the organs or tissues and joints of your body. I just like to look at the entire picture and see how many different contributors there are. If you have 5 things going wrong and you only test for 1 or 2, you're not going to get benefit. If there are 10 things wrong, which we could pick up on your blood test easily, and you correct 3 or 4 or 5 things, you're not going to get that result. So we have to look at all the things associated with your brain function, neurotransmitters, hormones, vitamins, heavy metal exposure. So yeah, we look at all of that.
All right, TikTok. I have a history of reacting poorly to certain medications and treatments. What precautions do you take to ensure that stem cell therapy is safe for patients with allergies or sensitivity?
Well, stem cells are your cells. That's not a drug. They're your cells, just like your hair, your brain, your eye, your toenail. I mean, they're your cells. So there's no reaction to your cells whatsoever in any way, shape, or form. The only medication we're using is lidocaine, just to numb the skin when we create that entrance to get them. So there's no downside, no side effect, no risk. Now, that's not true with other people's stem cells, umbilical or amniotic, which, the FDA doesn't like, and appropriately so. You don't know the genetics, the infection history. You don't know how the cells are kept, how many cells you're getting, et cetera, et cetera, et cetera. So your own cells are unbelievably safe and without risk. There, for many years, and there still are some tests that are, quote, genetic tests, which you should learn about. And years ago, we did these genetic tests because insurance companies were covering it. And they were not inexpensive tests. Some of them today are inexpensive. But the two different tests, one was called a PGX, the other was called a PGC. PGC was testing you genetically to see what your cancer risk is. Anybody in your family, especially the immediate family, if they had cancer, the insurance companies would cover this test to see if you were at risk for breast cancer because your mom or your aunt had it, or if you're at risk for prostate because your dad had it, et cetera. So I think they're great tests. The labs are charging a lot of money. The insurance company said, we're not going to pay that anymore. They're probably charging between $5,000 to $7,000. The other test, which is really cool, which doctors love, tells you how you metabolize medications. So there are 3 different categories that would show up. Either you should never take that drug because it would never work for you, the way you metabolize, because genetically it shows you how you metabolize drugs, and goes through cytochrome P450 systems, all these specific ways of metabolism. A drug that you could take that would work for you, or a drug that you should never take because it would be bad for you and you may have a bad side effect to it. The other category, which is pretty cool, is which drugs you should never take together because they would interact and create a problem for you. Brilliant test. What doctor wouldn't want that? Everybody did it. Insurance companies say, too much money. Now, there are genetic tests you could probably get either through 23andMe or Ancestry or some of these other companies online. They're a couple of $100. And you can get those tests done to see what you should or shouldn't be using as medication. So that's a smart test for people to do. Just even the medication part is a smart test to do because it tells you whether or not you should use this antibiotic or shouldn't, or blood pressure, cardiac pill, arrhythmia pill, you name it. Great test. But STEM are completely without risk or side effect because they're your cells, they're in your body. We're taking them out within a half hour, putting them back in.
We got this one. What are the key differences between PRP and stem cell therapy? How do you decide which is the best option for a patient?
So PRP and STEM are kind of in the same neighborhood. Not really the same family, but I'm trying to make it easy to understand. So PRP, you're taking your blood, spinning it, and getting 7 growth factors. Those growth factors can help to create some repair, but they're used up quickly over the course of 3 weeks to a month, and they're done and gone. They can be good. I've used it for better part of 15, maybe more years. I'm not sure exactly where the first PRP patient was. I kind of remember a company that worked for orthopedic doctors that presented the PRP information to us, and they had a Green Beret who was a physician after he got out, became a physician, really driven, hardworking guy. Took me a minute to remember his name. But they came down to the office, taught us how to do it. It's got to be at least 15 years ago. At any rate, PRP is good for little tears in muscles, small wear and tear, a little bit of damage here and there, but not for bigger or more extensive issues or problems. So we did a decent amount of PRP, maybe a lot of it back in the day. But as soon as stem cells came along, because stem cells are colonizing the area with cells that keep dividing, like having kids all over the place, keep going and going and going. It's a much more progressive benefit because those cells keep multiplying and keep creating repair. So it's short term, a month's worth, or stem that continue to go, onward and create much greater repair because of that division. People ask about, well, can you add PRP to stem? Well, it's already there because PRP is in your bone marrow, just like the stem are in your bone marrow, so you're automatically getting it. But the stem are miles and miles, a million miles apart from PRP. And when we started doing PRP, some people said, I got a little benefit, and you do a couple of them all the time. All of a sudden, by the time you're doing a couple of PRP, you're at the cost of doing the stem. So that's why people opt to do the stem much more so than the PRP.
Beautiful. We have an Instagrammer, finally. Where
Awesome.
have you been? Instagram. There they are. Okay. Hey, doctor, I've been getting random muscle aches, even when I haven't worked out. It's not constant, but it happens in different areas of my body. Is this inflammation? What do you think? 27-year-old.
Could be inflammation. Some people that work out will have more inflammation than others. Yet other people, depending upon the activities they do, and even without working out, sitting at a desk, what's your posture like, laying down, watching TV? I mean, you got to have aches and pains in any number of areas. Also, mineral deficiency will correlate with that. Vitamin deficiency will correlate with that. B6 deficiency, a lot of people get aches and pains all over the place. They can't figure it out. We have people that have delayed reactions to food allergy, and they have antibodies inflaming or irritating their muscles or their joints. Viruses can do that, and viruses can last a very long time, like Epstein-Barr and CMV. Not to mention, long-haul patients that have had exposure to COVID in the past. Lyme disease can cause multiple aches and pains, and a lot of people will be exposed to that. They don't get a bullseye rash, so they're not really thinking about a bug, but in some people, we've had to think about that, and we've tested and found that they're positive. So vitamin, mineral, hormone deficiency, infection, heavy metal exposure, all of these things can play a role. So that's what I would look at. Look at all of that. It should be relatively easy to correct because you're young.
Okay, YouTuber asking about dairy. They said that they're having a harder time digesting dairy lately. It's never been an issue before, but now I get bloated after eating ice cream or cheese, horrible sharp pains in my stomach, and not a fun day after. Could I have developed lactose tolerance later in life? What do you think's going on?
Usually, people that have those reactions have allergy. Lactose intolerance does exist. It's a fraction of the number of people that we see that have allergy. Now, let's define that a little bit. You could be allergic to the food and have any number of weird reactions all over your body because once it gets into your stomach and your gut and your antibodies bind, it can go anywhere. And for many years, I've had this thought that it's not only the food that you can react to, but the chemicals in the food. There are way more chemicals in the food now than ever before. The GMO garbage in food, it's just a completely different mechanism. So I have tons of patients, probably half to 70% of my patients react to things that they're eating. If we test and find the food allergy from a skin test, we take the food out, it goes away. If they're not reacting to wheat on a blood or a skin test, but wherever they eat it, they have a problem, it could be the GMO. There may be no classical IgE antibody response when we test them, but it could easily be the GMO mechanism. And those same people, when they go on vacation to South America or Europe and they're eating bread and grain and et cetera over there, have no reaction because it's pure grain, then it's the chemical in the GMO. So we see that. We see a lot of that. Food is not what it used to be. And I tell people to kind of, if you can, grow your own food, get everything organic, grow your own herbs and spices and make your own stuff. You could make your own ice cream, and I think that may be a better way to do it because then you're controlling what goes into the food. Just like people growing and making their own garden, you're really controlling all the good things going into that food so you're not getting something that's been sprayed or hit with chemicals over and over again. A few weeks ago, maybe a month ago, we spoke about arsenic in wine in California and whether it's high arsenic levels in the water or they're spraying. You're not getting pure grain. And, chicken can have 65 chemicals in it. Red meat could have 70 some odd chemicals in it. But you want to get as healthy, as organic as possible. But again, I would test for the allergy mechanism just to make sure. And also look for the lactose intolerance. Some people that will go out and take Lactaid or, take the little pills to try to see if that helps change the picture. You're not really diagnosing something, but if it decreases some of your symptom, it could be lactose intolerance. But I would still test via skin for allergy. Just get the full answer done, right away.
Okay. TikTok. I've been noticing there's a 44 male. I noticed that his hands shake a little when I'm holding something like a cup of coffee. It's not dramatic, but it's new for me. Could that just be stress, or should I get it checked out?
Stress can do it, and sometimes deficiency of minerals, magnesium, potassium, calcium could do that, cause a little bit of twitching and cause a little bit of a tremor. There are some people over time that develop an intention tremor or a familial tremor, and sometimes that's all it is and just will not progress beyond that. Yet other people may have other things that are happening, behind the scenes that are creating that problem. Not to scare you, but there are people that have tremors that have Parkinson's, and you're young for that, but there are people that the circumstance has been brewing behind the scenes. Heavy metal exposure we know correlates with Parkinson's, and heavy metal exposure may be more in your case than someone else your age, and maybe setting the stage for that. So we'd like to be able to look at all the components and certainly do blood and urine for heavy metals and see what your body's exposed to. Without knowing what kind of work you do, there may be something at the workplace that's giving you exposure. For some, working with aluminum or metals certainly can do that. Guys cutting the aluminum studs that you drill the sheetrock into. It doesn't have to be doing that, or in a foundry, mercury is in fillings of your teeth and fish, arsenic in chicken, shrimp, rice, apples, California wine, aluminum in pots and pans, antiperspirant. So the list of metals and exposure is huge. So I would check for that.
So we had a question. So on Instagram, if I look at the chat and then I X out the chat, I lose those questions. So I lost the question, but it was basically someone asking about their mother's about 75 years old, and she's starting to show her age a little bit, and they were just wondering, is stem cell a good idea for just like an older person in general? Someone starting to get more stressed out.
The hallmark of stem cell, as we mentioned and have said many times, and I've said over many years, you're putting brand new amazing cells into your body to go to shut down the inflammatory cascade and to make brand new cells wherever you have damage or degeneration. So in one person, aging could be because their pancreas has become tired and now their sugar levels are higher than they should be. And sugar damages your cells, damages your blood vessels, your nerves inside your cells. Glycation is sugar damage to your cells. So that may be happening in one person. Another person may have plaque in their blood vessels. Someone else may have hormone decline, with age, and now their hormones sometimes are at the low end of normal. Sometimes they're full-on low below normal, where you'd have typically much more significant symptoms. So aging is loss of cellular function, loss of cells, and loss of hormones and neurotransmitters, that which stem cell can help. As I look at the entire picture for that person, I want to achieve the greatest result. I want them to get great vitamins, mineral, hormone levels, exercise. Stem cells would be ideal to create repair in any of the organs, etc., brain. So you want to put together a whole program for that person to get the best results possible. There's an old saying, I don't know who said it, but you want to die young at a very old age. Makes sense. Why lose function as you get older? With all the things we know now, work on getting your body strong now, whether you're 20, 30, 40, 50, etc., make your body strong and as healthy as possible so that you prevent these bad problems from happening down the road.
Beautiful. It's a great saying. I need to find out who wrote that one.
It's definitely a good comment.
Yeah. So this one is also TikTok. I am 50, been feeling bloated after even small meals. I don't think it's a food allergy, but it's happening more often. Could this be a digestion issue, or should I get checked for something more serious?
The people that talk about a variety of things causing the stomach symptom or bloating could have inflammation in the stomach beyond an allergy. You still have to test for allergy because That's the most common. Sometimes people that take in too much sugar have bloating right away because the organisms in your gut kind of ferment as you might expect when you're taking malt, barley, and hops and making beer. So that issue occurs in your gut. More often than not, it's related to a delayed reaction to a food. But if you have multiple things bothering your stomach, you could have inflammation. You could have a gastritis. It could be a bug, a bacteria, or a virus. So we would need to look at all that and see what the absolute cause is and then be able to change that. It's very common.
We got a Charlie horse question here.
Okay.
I've been getting many more Charlie horses in my leg, especially at night. I am drinking a lot of water. I don't think this could be dehydration. Is this a sign of vitamin deficiency? What are your thoughts?
It could be magnesium, potassium, calcium deficiency. That's common. Yeah, we do see a lot of people that are dehydrated, and it's relatively easy to drink a good amount of water to get the hydration levels up. But on one extent, sometimes you drink a lot of water, too much water, you're really diluting those nutrients. And if your nutrients are low to begin with, then you're not really fixing the mechanism. So you'd have to test your vitamin, mineral levels, look at hormone levels. For a lot of people, any musculoskeletal concerns, I tell them you need to go and start getting some massage. Go to a place where you can get a chair massage. They can work your neck, your shoulders, your arms, your back, or get the full-blown massage. I think it's a great idea because you want your muscles to be worked. You want them to be stretched. You want blood flow to go through there. You want to do exercise. And as I tell people on Tuesday nights, I go to a full contact karate class with some great friends. I've been doing this for a better part of 17 years. And, we get banged up. It's a full contact class, just kind of no holds barred, throwing, spinning kicks, striking, whatever, grappling. And a day or two later, I'm going to go for my chair massage because I need to have that stretch, I need to have that improvement. And you feel great with that. But we have to determine why your muscles are reacting that way. And for some people, and for a lot of people, once we get that initial hurdle, covered, then we'll make sure they're doing a good amount of activity and keeping those muscles stretched and in tone and keeping the blood flow and delivery of oxygen, vitamins, minerals, and hormones appropriate so that the Charlie horse doesn't occur again. 888-420-9272. Give us a call from any of these marvelous platforms. Give us a text, an email, however you want to reach us.
We're going to start having a graph, and as the show goes, we're going to see which channel is winning. And listen,
we're going to have to
Rumble,
give some kind of a prize away.
Listen, Rumble's got the highest views, all right. But listen, your questions, you're slacking a little bit, Rumble. I'll say it.
All right, our Rumblers. We want to hear from our Rumblers.
Yes. We got where to go. Okay, yeah, we got one. Dry eye from TikTok. I've noticed that my eyes feel really dry, especially in the evening. I don't wear contacts, but I do stare at a lot of screens for work. Could that be causing it, or should I see an eye
there
doctor?
are people that have occupational issues with looking at screens and computer screens all day. Some people will either put a film over the screen, and some people might wear a little bit of not a full-blown sunglass to try to prevent some of that. Other people may use drops. Some people may have allergy that contributes to that, yet others can have an autoimmune problem called Sjogren's syndrome, where Sjogren's gives you dry eye, dry mouth. So again, testing to look to see what's occurring there. The blood test for Sjogren's is a simple, autoimmune marker test, so that's easy to do. But again, we have to look for all the underlying reasons why. And in people that may have that in the family, a relative, aunt, uncle, father, brother, sister, mother, whatever, if they have that, then you might more likely have the autoimmune mechanism because those are typically run in the family.
All right, what do we got? This is your chance, people. Last call, as we say.
That's right. We'll be here for a few more minutes.
Yeah. Usually, the Saturdays, we can't stop the questions. What do we got here? Let's see.
1-888-420-9272, and you can call and ask questions. Oh, so I wanted to comment on Low Carb Bible. Low Carb Bible is a book that's been around forever, written by Elizabeth Ward. It's a great, simple book to read. I've been recommending it to patients for many years. It's still available on Amazon and Google, although I don't know how many printings it's gone through. So the low carb recipe books, There's a staggering number of these on Google and Amazon. There's the new 500 recipe low-carb recipe book. The new, not the old. 500 recipes is a lot. I don't think I know anybody that can go through 500 recipes, even people that, own pretty busy restaurants. There's the 5-ingredient low-carb diet, which is interesting. 5 ingredients. There's the easy low-carb cookbook, which is nice. Is there a not-so-easy low-carb cookbook? Is there a moderately difficult low-carb cookbook? Maybe. I didn't scroll that far. Low-carb diet handbook. Low-carb diet for 2. Low-carb diet. Is there a low-carb diet for 10 or more? How big is your family? There's a 30-minute low-carb diet, which is great for people who don't have a lot of time. And, like me, I'm hungry. I don't want to wait more than 30 minutes to eat. The low-carb diet for beginners. The low-carb diet for experts, maybe. There's the Dirty Lazy Keto book, which I swear to God, I saw this as I looked on Google. The Dirty Lazy Keto Cookbook. Great name. You'll never forget that name. So for people out there who are dirty and lazy, or lazy and dirty, whichever way you want to see it, that might be the cookbook for you. There's the, I can't remember my handwriting, Wholesome, Easy, Yummy Keto book. And honestly, I could have written these things down for an hour, but suffice it to say that if you want to look at some of the good books, if you prepare your own foods, and you should, there are lots of ways to do that. A lot of advantages. So you can get dirty, lazy, easy, breezy, 30-minute, etc. 500 recipe books. See what you like. And they're cheap. Some of them are 10, 14, 15, 20 bucks. So it just gives you flexibility so you're not having the same food over and over again. 888-420-9272 if you'd like to call in. You can do so now. Frank looks like he's got an interesting look in his face. So.
I'm looking. There's so many different, we just add more and more platforms. So I refresh. I'm looking through my tabs. This is your
We're going to have to get into like third dimensions and Star Trek stuff where we're going beyond. I wonder if we would get contact from, because they're saying all the pilots in the Navy and stuff say they've seen extraterrestrials and aircraft and all that stuff. This is a whole new thing. It's going to be pretty cool. I wonder if they're able to watch our Star Trek TV series and things like that. I wonder if they laugh at it or they think that it's cool. Or if they're going to ever call into a show like this. It'll be interesting.
They're probably like, wow, they're pretty good. They're pretty close.
Alrighty then. Great show, great calls, lots of good information. And as I used to say, get your pen and your notebook ready. Write down everything you can, learn, buy some books, get your exercise done, learn about the best foods to eat. Of course, walk every day, indoor, outdoor, whatever you like to do, at least 30 to 45 minutes of nonstop activity, and learn about your body, maximize your health, optimize your health with this knowledge. We'd love to help you out. The phone line to the office, 516-794-0404. The website is drcalapai.com, and we're there for you. Have a